Dear students, today we will discuss some of the MCQs in hematology. First question: von Willebrand coagulation protein is associated with factor 9, factor 8, factor 5, factor 10. Right answer is factor 8. Von Willebrand is a blood glycoprotein which is involved in hemostasis. So it helps in platelet adhesion. The factor associated with von Willebrand is factor 8. If there is deficient in factor 8, it can lead to von Willebrand disorder. Cobalamin deficiency leads to pernicious anemia, pellagra, scurvy, hemolytic anemia. Answer is pernicious anemia. Cobalamin is also known as vitamin B12, vitamin B6, vitamin B3 and vitamin B1. Right answer is vitamin B12. Cobalamin is also known as vitamin B12. Factor deficient in classic hemophilia is factor 8, factor 9, factor 10, factor 11. Factor deficient in classic hemophilia is factor 8. There are three types of hemophilia: hemophilia A, hemophilia B and hemophilia C, in which hemophilia A is most common, so it is called classic hemophilia. Factor deficient in hemophilia A or classic hemophilia is factor 8. Which disease is known as Christmas disease? Hemophilia A, hemophilia B, hemophilia C and hemophilia D. Right answer is hemophilia B. Hemophilia B is also known as Christmas disease, in which the factor deficient is factor 9. So why it is called Christmas disease or Christmas factor? It is known after a patient who is a 5-year-old child in whom the first hemophilia B was detected. His name was Stephen Christmas. So the disease is known as Christmas disease. So Christmas disease is otherwise known as hemophilia B, in which factor 9 is deficient. Which is the primary site of hemolysis? Spleen, liver, kidney and femur. The primary site of hemolysis is spleen. Which one of the following is autosomal recessive? Neurofibromatosis, Marfan disease, thalassemia, achondroplasia. So among the following, thalassemia is the autosomal recessive disease. Thalassemia is an inherited blood disorder due to decreased RBCs in the blood than normal. It can cause anemia. Next question. Total RBC count in women ranges from 4 to 5, 5 to 6 million per cubic deciliter, 3 to 4, 2 to 3. The right answer is 4 to 5. Next question. Metabolically available storage form of iron in the body is hemoglobin, hemosiderin, ferritin and transferrin. The storage form in the iron is in the form of ferritin and hemosiderin. Metabolically available storage form of iron in the body is ferritin. So the right answer is ferritin. What is the lifespan of RBC? Easy question. 120 days, 45 days, 180 days, 90 days. The answer is 120 days. Lifespan of RBC is 120 days. Allergic reactions are associated with lymphocyte, neutrophil, basophil and eosinophil. The right answer is eosinophil. Cause of jaundice in thalassemia is hemolysis, hepatitis, iron overload and anemia. So what is thalassemia? Thalassemia is an inherited blood disorder due to decreased RBC in the body than normal. The jaundice in thalassemia is due to hemolysis. Normal thrombin time is how much? 11 to 15 seconds, 20 to 40 seconds, 2 to 5 minutes, 5 to 8 minutes. Normal thrombin time is 11 to 15 seconds. Best source of bone marrow from a 20-year-old person is, so the site of bone marrow from a 20-year-old person is femur, iliac crest, radius, tibia. So the best source of bone marrow from a 20-year-old person is iliac crest. Hemoglobin level changes in morning and evening is 1.5 gram per deciliter, 2.5 gram per deciliter, 3 gram per deciliter, 4 gram per deciliter. Right answer is 1.5 gram per deciliter. Thank you for watching the video. If you are watching the video for the first time, please subscribe the channel. Please like, comment and share the video to your friends. If you find this useful, please comment it. Please subscribe the channel. Thanks for watching.